Welcome once again to FHN's Community Update video. This week I'm pleased to be joined by Margie Kochsmier, who is our infectious preventionist, who is our in-house expert and very knowledgeable with many years of experience, and I'm grateful to have Margie guiding us through this journey. So this week she's going to talk a little bit about what's really important to a lot of us, which is our kids and also the concerns about school. So Margie, thanks for joining us.
Well, anybody can be infected with COVID-19, adults as well as children, although when children get COVID-19, they have less symptoms. They're more mild than the adults are. The adults have made up the majority of the population of our positives. Since anybody of any age can transmit this through direct or indirect contact, we know directly you can transmit this by talking and having your droplets fall on somebody's eyes, nose, or mouth, handshaking. Indirectly, it would be if somebody coughed on a table and then you touched it and then you touched your face. When we follow the precautions that we've put into place, this reduces the amount of transmission that we'll see. Community transmission will kind of affect the way we're going to see the transmission in school. So if you see your community with large numbers of COVID-19, you're going to start seeing cases in the school too. And also remember that people can transmit this without having any symptoms at all. That's correct. Kids are not immune to COVID-19. There's over 300,000 children in the United States that have had it this year. And while we're not seeing a lot of kids under the age of 10 that have gotten sick with this, these are also the age groups that have been at home. So we'll see once they go back out into the community if we see those numbers go up. We've also seen an increase in testing. So as we increase testing, we're going to increase our positives as well. So until we have a vaccine, we're probably going to see more kids and more adults test positive. Parents are the role models for our children, and they need to inform them without scaring them about this because this is fairly new for them. Let them practice wearing a mask before they go back to school. If they haven't worn a mask much and been out in public, let them start to wear that mask and see how it feels for wearing it for long periods of time. Support them not attending large events where there's a lot of people in contact with one another, and then let your kids see you practicing the same preventative measures that you're telling them to do. Try to help the parents or the children wear these masks because they haven't worn them much. They've been at home from school. Make it fun for them. Show them how to keep distances from other people. They can put their arms out like wings, like an angel, and tell them this is how far I have to stay away from somebody else. Or you can use a hula hoop and have them say this is the distance that I need to be from someone else. These kids will follow what you tell them to do, so be good role models, and posters will be helpful for them. They'll be good reminders for them how to wear their mask and how to wash their hands. But with social media, we see a lot of positive and negative opinions from a lot of people on a lot of different topics, and this pandemic is going to be one of them. Kids want to feel like they belong, and they don't want to look like they're doing anything differently from anybody else. My suggestion is to have them educate themselves using reputable sources like the CDC and learn why this is important for them to follow these. This is a good life lesson for them, and they will start to be able to make decisions on this is the right thing for me to do because it's going to keep me safe. As restrictions are being lifted and kids are returning back to school and some events are starting to happen, we need to remember to keep those precautions that we've discussed before. The hand hygiene, wearing masks, keeping social distancing. At home, don't forget to keep your high-touch surfaces wiped, the light switches, things that are shared, the computer keyboard, telephones, the handles on the refrigerator, and know that if there is somebody that is susceptible in the home and somebody gets COVID, you may need to wear a mask or keep your distance from that person. We still have to keep our high-touch surfaces wiped down. We've learned a lot during this pandemic. We've learned how this virus is transmitted from one person to another, but there's also other germs that can be transmitted the same way. So by keeping the high-touch surfaces wiped down, just like we do during flu season, we can help keep our families protected. School physicals are still required by schools, and this is a way to keep our kids healthy and keep their immunizations up to date. We have an immunization schedule and physical schedule on the FHN.org site so that you can review this. It's important for kids to get together with their friends. They've been inside so much and they're not doing some of the sporting events that they did before, so it is important for them to get together, and there is a safe way for them to get together if you stay within the same group of people, so that if there is an outbreak within a group, it'll be easier to do your contact tracing. Look at this in terms of what is the risk to the child. So a low risk would be not getting together and having a play date and getting together electronically through their devices to communicate with each other. A moderate risk would be getting together with the same group of people seldom, and then wearing a mask or keeping the distance. And then the highest risk would be no mask, getting together indoors, meeting often. And these are the things that are going to increase our risk for these kids. So understanding your risks can help keep you safe and can help the kids have a play date safely.
A number of things we've been doing is making sure that we are available to be able to help with school physicals and sports physicals, as well as really keeping up on immunizations and making sure that we have easy access for parents to be able and guardians to be able to bring their children into our offices to hopefully ensure that they get off to a healthy start to the school year. Thankfully, we have not seen a large amount of school-age children that have positively tested for COVID-19. However, we still have seen school-age children being positive. Many of them, thankfully, have been able to recover at home, but there still have been school-age children in our area that have been positive for COVID-19. Many of the guidelines that school administrators are following are from the Illinois Department of Public Health, and those guidelines are oftentimes in cases for Illinois, because of our rising positivity rates, more stringent than the Centers for Disease Control and Prevention. So they're taking extra precautions to try and protect our young people. Those policies are mandated by the school, usually with the guidance of a local health department. But a few general guidelines that are usually in place is that the student needs to maintain being fever-free without any medication for a period of up to 10 days. In many cases, they'll also require to have a COVID-19 test come back as negative, including a letter from their physician or provider stating that the student has tested negative before they'll be allowed to return. This is one of the areas where the Illinois Department of Public Health is more stringent than the Centers for Disease Control and Prevention, that does not require a negative test for return to school. Most likely, during the beginning of the school year, students would be tested at our COVID-19 aid tent, which is located in the parking lot of our hospital. However, we are developing a standalone location for this fall that will be indoors and more conducive to the weather. So please stay tuned to our website, and we'll share more information in upcoming videos as to the locations. Generally, once a student's received a COVID-19 test, for the normal testing turnaround, it can take up to 72 hours before we get a result. Once that result is received, the students and their families, of course, would be contacted to make them aware of what the result was, and then also any appropriate clinical follow-up that they might need to get. Certainly, some students have severe asthma or difficult respiratory types of afflictions that would preclude them from wearing a mask. In that scenario, our providers, our physicians are prepared to write notes that the students would be able to provide them to school administrators as to the medical rationale as to why they could not or should not be wearing masks. Here in our local area, we have seen an increase in the number of positives per our testing ratio. However, gratefully, we are not seeing a lot of increase in those people that are highly symptomatic, and certainly have not seen big changes in the need for hospitalization. Since our last community video, we've seen an average of 1 to 2 positive COVID-19 patients within our facility and have remained fairly steady and low with that volume. I think any large group gathering creates an increased risk of spread and contagiousness, and I'm hopeful and optimistic that the appropriate social distancing, the frequent hand washing, masks, and other guidelines and precautions that are being put in place will help us control that. However, it's something that we need to be extra diligent about, because once again, we're starting to bring more people together into a confined space and need to be very cautious as we do that if we want to minimize any resurgence this fall. I'm very concerned about a resurgence or an increase in positivity rates this fall. We have a number of factors that can complicate the situation, including influenza. Also, RSV, or another respiratory type of virus that typically starts to occur in fall, in addition to being indoors more often because of the change in the weather. So we're very cautious of fall and the potential of seeing those increased volumes. So one of the things that I would appeal to our community is to please ensure that you're taking all of the appropriate precautions to help us avoid that. I think the most important thing for any school year is to focus on the learning. It's certainly going to be a different year. Lots of changes are being put into place, and that's going to require all of us to be very adaptable. Things may change from week to week, but one of the things that shouldn't change is our priority to create the best learning environment that we can for our students. So as parents, guardians, as community members, let's work together to make sure that we do maintain that focus on the learning for the benefit of the student. Another way to do that is to make sure that we are adhering to all of the guidelines that are being shared with us to ensure that that child's safety is first and foremost, and we're doing all that we can to limit the spread.